We go now to medication errors. So, learning outcomes of this topic is that we can able to list at least 11 different types of errors, medication errors. Identify factors that contribute to medication errors. List 5 high alert medications. Describe methods of preventing medication errors. List examples of common medication errors. Describe possible consequences of medication errors. Explain different steps to be taken when an error is identified, and explain the role of quality assurance monitoring of medication errors. So what are the different types of medication errors? So we will discuss the following errors: the prescribing errors, omission errors, wrong time errors, unauthorized drug errors, improper dose errors, wrong dosage form errors, wrong drug prescription errors, wrong administration technique errors, deteriorated drug errors, monitoring errors, and compliance errors. So, prescribing errors usually occurs when a prescriber, the physician, orders drug for a specific patient. The drug itself, okay? It might be an error in the generic name or impossible error based on the prescription. Yeah, there is what we call a different, the brand name does not coincide with the generic name, the dose of a drug. Okay, so there is an error there. Example: cefuroxime 750 milligram. It will lead to an error: cefuroxime 750 microgram. So there will be an error there. Dosage form, it might be tablet or capsules or caplet. Okay, or an error like for example that injectable drugs and the prescribed drug is considered to be an oral drug, okay, or oral medications, antibiotic. Route of administration, okay, instead of per oral to there's an error, I mean in taking drugs instead of per oral, so there is an error in route administration. So the route administration given is IV or IM. Example: so length of therapy, okay, how long the therapy is, the number of days. This refers to the number of days of the therapy. Number of doses. So how much is number of doses? It's 300 milligram, 400 milligram. Administration. So administration, it refers to the route of administration also. Okay, the time, drug concentrations. So drug concentrations refers to the pharmacokinetic uh, uh, parameters or pharmacokinetic aspect of administration drug. Okay, inadequate or incorrect instructions were used. So there is what we call a misinterpretation or incorrect instructions or informations given by the prescriber, and of course illegible handwriting of the doctor. That is usually common. Okay, next. So omission errors: failure to administer an ordered dose, not late dose. So meaning an ordered dose is given in a specific time, there is a failure there. So late dose is not. When I say failure, there is no administration of a drug based on the time. Example, at 1 o'clock a.m., there should be given a dose of a 1000 milligram or 150 milligram or IM example. So there's a failure there. Not late dose is not, okay, because even it is late dose, but there is no failure of giving the specific drug for the given by the order of the doctor. Omitted dose is not an error when cannot take anything by mouth. So nothing on NPO. There is NPO is not a omitted dose. Okay, providers are waiting for drug level results. That's one that is very important, because a level of the drug is important, especially if the patient is suffering, if this a patient is immunocompromised or ICU patient. Okay, drug level results is based on the plasma concentration of a drug itself. Okay, and drug level is very important because If there is a higher level of a drug that is present in the plasma, it will lead to a toxic effect already of a drug. And patient refuses. So when you say patient refuses, if the patient cannot really take the drug and refuse, so that is not a error. Means you omit the dose, you remove the dose. Okay? You remove the dose of the patient, that is already an error there. Okay? For example, there is what we call an deleted. You delete the dose of the patients based on the computer record. So it will lead to an error already. That is omission. Okay? Or removal. Next, wrong time error, standardize administration time. So standardize, so if the administration time is 1 gram IV every 8 hours, so you have to follow that standardized administration times, because that is the uh, standard time to administer a drug. So every 8 hours. So that is wrong time errors. Example, acceptable interval surrounding schedule time. So the interval of a drug between the two drugs, there is an interval between two drugs, antibiotic and another drug. There should be acceptable interval surrounding schedule time. So you cannot give all the drug at one administration only at one time. Okay, it will lead to different drug interactions or even a toxic effect also. Next, another one.